I'm Dr. Weiner from Orlando, Florida. As a veterinarian, one of the most common things I do is give vaccines to dogs and cats. And today I'd like to talk about why we recommend vaccines and what they are, and what are the common types of vaccines that your veterinarian will likely offer to your dog, and what are some of the side effects to look out for, and how common are they really? So vaccines are a small dose of a either weakened or killed microorganism or virus administered to the dog's immune system that's supposed to mount an immune response, which causes protective memory cells to develop. If that dog ever does get exposed to that disease, those memory cells are already in place, so that way they can just attack that disease before it ever becomes a problem, thus protecting the dog. One of the other benefits to vaccines is that if as many individuals, the more individuals that are protected, the less that disease will spread, which then leads to a phenomenon called herd immunity. So the more individuals that are protected, the more likely that the whole herd or community will be protected. So if one individual might not be vaccinated, they're still somewhat protected because the chance of getting exposed to that disease is less likely because everyone else is immune to it. So that's another benefit to vaccines, is that it's not only the individual, but you're also protecting the community by getting your dog vaccinated. So what are some complications of vaccines? Well, let's back up and talk about the safety of them. Vaccine companies don't just release vaccines. They go through intense trials and tests and very, very thorough research, years and years of research before they can actually be released into to the public and deemed not only safe but effective as well. So the chance of an actual disease caused by the vaccine is extremely unlikely. Adverse reactions to be concerned about. Keep in mind that we are stimulating the immune system, so we are causing an inflammatory response. So a little bit of sleepiness or lethargy or maybe soreness at the site of the injection is not uncommon. That typically goes away, within a day, maybe even after a long nap if they ever get sleepy at all. That's pretty common. That should be expected. Other more serious adverse reactions can include vomiting, diarrhea, hives where they get little bumps all over their skin, facial swelling, their face swells up, or even trouble breathing. Now, there was a study done in 2005 that looked at over 1 million dogs that were vaccinated, and the conclusion came out to be less than 1%. So I think it was 0.38% of dogs vaccinated actually get a serious reaction, less than 1%. So the chance of your dog getting that is extremely unlikely. So that's good. If your dog does get that, a reaction, typically will happen within the first 20, maybe 60 minutes. Could take a day, but mostly it's pretty quick. What you should do is contact your veterinarian right away, and they will help not only curb the clinical signs and help your dog feel better, but also make a note of it so for future vaccines, protective measures can be taken, or preventive measures can be taken, so that it doesn't happen again. So that can include splitting up the vaccine so it's less for the immune system to deal with all at once. So that might help. Sometimes giving an injection of an antihistamine like Benadryl 10 minutes before the vaccine will also prevent a bad reaction, or even an anti-inflammatory sometimes. But really it depends. But these are tools that we can use so that way we can still give vaccines to your dog without them getting sick or having any issues, but still being protected with that vaccine. Reasons that you would not vaccinate your dog again was if it's a life-threatening reaction like trouble breathing or a full anaphylactic reaction, or if there was some debilitating disease that makes that pet unsuitable for vaccinations. Another thing that might help decrease the chance of risk is actually going to an actual veterinary office or a hospital, more likely to get a full physical exam. And this is instead of a mobile shot clinic. The shot clinics are designed to streamline vaccines and give them right away, so they don't really take the time to do full physical exams every time. If your dog does have a reaction, it's likely to happen within the first 20 to 60 minutes, and by that time, or later, and by that time the clinic may have already gone away. So one other thing to keep in mind. Now, what are some types of vaccines, or the most common categories of vaccines that we recommend? So vaccines are divided into two categories, core and non-core. So core are the vaccines that every dog really should have, or the required ones. And then the non-core ones are the more risk-based ones. So what is your dog's risk of exposure to those certain things? So the core vaccines are rabies and distemper. Rabies is required by law in most states. It is 100% fatal to both animals and people, so we do not mess around with that one. It's most known for that aggressive form, but it can cause any number of neurologic diseases or neurologic clinical signs. And there is no really good test for it while your dog is alive. Only the accurate tests are after the dog already passes away. So that one we really don't want to mess with. And if your dog bites someone and they're not vaccinated or not up to date on vaccines, that pet owner can be liable. And have a bunch of court issues. So we don't want that. Distemper vaccine is actually a combination of many different vaccines. That includes distemper virus, which is in the environment. It can cause neurologic, respiratory, or skin diseases, and that could be very serious as well. That same virus also protects against hepatitis, and parvovirus, which is a virus that's extremely contagious, and it attacks rapidly multiplying cells. So that's mostly the lining of the small intestine. So when they get that, they don't have any absorptive ability to take in their nutrients, so they get severely dehydrated. Doesn't have to be life-threatening, but it can be. And then the other part of that vaccine is parainfluenza, which is another upper respiratory tract infection. So those rabies and the distemper shot are two core vaccines that every dog really, really should have. It's very important not only for them, but for any other dogs in the house, or even any people in the house too. In the next video, we'll talk about the non-core vaccines and then the schedule that we recommend for puppies that come in, and even adults that either have been vaccinated in the past or have not, or have no known vaccine history. All right, stay tuned.